name is Lindsay Blankenship, and my poster presentation is on recognizing shift work disorder as a primary care provider. To start off, my abstract states that shift work is defined as non-standard working hours, including but not limited to night work, weekend work, compressed work week, split shifts, on-call work, and varying or rotating working hours or schedules. Numerous studies identify a link between shift work and health problems. Shift work disorder is a sleep disorder associated with an individual's work schedule and is characterized by the hallmark symptoms of insomnia and sleepiness. While about 20% of workers in the United States are involved in a shift work environment, the diagnosis of shift work disorder is difficult to obtain and often goes undiagnosed. Patients experiencing sleep disturbances typically seek treatment from their primary care providers. Therefore, it's essential for primary care providers to conduct a thorough work and sleep history while utilizing screening tools such as the Insomnia Severity Index or Epworth Sleepiness Scale in order to recognize shift work disorder in a primary care setting. By identifying shift work disorder, primary care providers have the ability to treat symptoms early, prevent health complications of circadian rhythm disturbances, and improve the quality of life of numerous patients. Next, I'm going to go over a brief review of literature that I used for this poster presentation. An article by Barger et al. Emphasizes the importance of using questionnaires in the primary care setting to screen for shift work disorder. The authors state the negative impact of shift work disorder on the shift worker's work and home life, and therefore the importance of being able to recognize the disorder as a primary care provider. In an article titled Treatment Options for Shift Work Disorder, Salamanca accentuates the fact that most individuals do not seek treatment from mental health providers for sleep disturbances. Rather, primary care physicians are typically approached by patients for such conditions, putting PCPs at the front line for being able to assess, diagnose, and treat shift work disorder. Salamanca states that the primary goal for shift work disorder patients is to facilitate restorative and high-quality sleep and to ensure sustained alertness. Hagan et al. Defines shift work disorder as a disorder characterized by the main symptoms of sleepiness and insomnia. The study conducted on staff nurses in a tertiary care hospital in India found that 43% of the nurses had shift work disorder. Hagan et al. Highlights the importance of being able to differentiate between sleep problems associated with one's work schedule and those bearing no relation to one's work schedule. In addition, emphasis is brought on the topic of being able to recognize shift work and its essentialness regarding shift work scheduling, employment routines, clinical treatment, employee selection, and employee safety. An article titled Effect of Shift Work on Sleep, Health, and Quality of Life of Healthcare Workers by Nina et al. States that several studies reveal that shift work disorder can cause numerous health problems due to the chronic misalignment between the circadian timing system and the behavioral cycles like your sleep-wake cycles and your fasting and your feeding cycles. The study conducted by Nina et al. Shows that shift work disorder has negative effects on the patient's everyday life, functionality, and health due to the impairment of sleep quantity and quality. Singer et al. Emphasizes that nearly 20% of the U.S. labor force works some type of shift work schedule, and not just healthcare workers. Other types of shift workers include transportation workers, mining workers, law enforcement, military services, and governmental emergency services. The authors state that the shift work circadian rhythm disturbances lead to adverse cellular activity, which then leads to chronic diseases such as decrease in renal function, abnormal production of hormones, insulin and glucose dysfunctions, and decrease in cardiac and metabolic autonomic regulation. Therefore, it's essential to prevent shift work disorder to maintain a healthy community. An up-to-date article on sleep-wake disturbances in shift workers by Chang and Drake stresses the importance of a thorough history from the patient in the primary care setting in order to adequately diagnose the patient with shift work disorder. In addition, the use of questionnaires such as the Epworth Sleepiness Scale and the Insomnia Severity Index are crucial for identifying shift work disorder. Chang and Drake affirm the importance of recognizing this disorder due to the risk of adverse health outcomes. So let's discuss a little bit more in depth shift work disorder. Shift work disorder is a sleep disorder associated with various signs and symptoms that have the potential to decrease quality of life. Shift work disorder is linked to a disruption in the normal circadian rhythm cycle, causing increased risk for numerous health problems. So when a patient with shift work disorder presents to the primary care setting, they may present with some of these symptoms listed right here: sleepiness, insomnia, lack of energy, difficulty concentrating, irritability, feelings of anxiety, or even feelings of depression. As I mentioned earlier, there are many health disorders associated with shift work disorder, and a few of them are listed right here. The main ones include cardiovascular disorders, obesity, metabolic syndrome, diabetes mellitus, mood disorders, depression, cancer, and impairment of cognitive function. So that's why it's essential for primary care providers to be able to identify and link some of these vague symptoms with shift work disorder so that we could potentially prevent these other conditions that could be potentially severe from occurring in today's population. So a few treatment options listed right here for shift work disorder include planned napping or sleep scheduling. This improves alertness and performances among shift workers. Timed light exposure. This decreases sleepiness and improves alertness during shift work. Using melatonin. This can promote daytime sleep, or hypnotic medications, which also promotes daytime sleep. The use of modafinil, which enhances alertness during shift work, or the use of caffeine, which enhances the alertness during shift work. So there are a lot of implications for advanced practice registered nurses and primary care providers overall. Primary care providers have the ability to recognize shift work disorder, treat the signs and symptoms early, and potentially prevent other health complications associated with shift work disorder from occurring. Patients can be assessed for shift work disorder by utilizing the screening tools mentioned, the Insomnia Severity Index or the Epworth Sleepiness Scale. In addition, a thorough health history by the provider is really essential, including an assessment of the work history, a detailed sleep history, and medication history to see what medications the patient is already taking or has tried and hasn't worked. And this can help providers recognize patients with shift work disorder. So if shift work disorder is suspected, the patient can use a sleep diary and wrist actigraphy for at least 14 days to see if they demonstrate a disturbed sleep-wake pattern. By being able to recognize shift work disorder in the community, primary care providers can treat the individuals and improve the quality of life of numerous patients while preventing severe health conditions from occurring. So here I have listed a few things that I've already talked about, the screening tools for shift work disorder. The Insomnia Severity Index is one that's used for assessing sleep disturbance for nighttime versus daytime sleep. It has 7 questions in which you rate your difficulty falling asleep, difficulty staying awake, problems waking up too early, satisfaction or dissatisfaction with your current sleep patterns, how noticeable others think your sleep patterns impair the quality of life, how worried or distressed you are about your current sleep problem, and to what extent you consider your sleep problem interfering with your daily functioning. So is the patient having daytime fatigue? Are they able to do their chores? Are they having difficulty concentrating? Do they feel like their memory has decreased? Are they having altered moods and things like that? So they basically fill out this questionnaire and add up the total score, and a score of greater than or equal to 10 on the ISI is indicative of clinically significant insomnia. So here is the Epworth Sleepiness Scale, which is an additional questionnaire that could potentially be used, and that assesses excessive sleepiness. So the patient rates their chance of dozing off while sitting and reading, watching TV, sitting inactive in a public place, as a passenger in a car for an hour without a break, lying down to rest in the afternoon when circumstances permit, sitting and talking to someone, and sitting quietly after lunch. So they fill out this questionnaire, they add up the total, and a score of greater than or equal to 10 is indicative of excessive sleepiness as well. So the patient could also use an actigraphy wrist sleep device, which along with a patient sleep log can determine sleep-wake disturbances if shift work disorder is suspected in the patient. So this is a picture of the actigraphy device, and the patient places it on their non-dominant hand while they're sleeping, and that measures movement and light exposure. So evidence has just showed that paired with sleep diaries, actigraphy can be really helpful in the care of shift work disorder patients. So in conclusion, diagnosing shift work disorder is a challenge for primary care providers, mainly because the patient is presenting with such vague symptoms. So it's really essential for primary care providers to have any of these symptoms listed, trigger an alert for them to really assess the patient's work history and sleep history, and screen the patients for shift work disorder in order to distinguish whether the symptoms are related to a shift work schedule or not. And shift work disorder and shift work in general can cause numerous health problems in the community. So by recognizing the importance of knowing a patient's work schedule and sleep history, providers can not only establish more rapport with their patients, but also improve their quality of life.